Welcome to Phase 2 of Rethink Health's Pathway for Transform. As with each phase, we'll address key pitfalls and momentum builders of Phase 2. Let's explore how groups that have worked together move forward after they've successfully engaged in collaborative campaigns in Phase 1, focused on single problems in their region or community. How do they sustain engagement? And how do they build momentum into Phase 2? What we've seen in our work is that many influencers and leaders in regions or communities seize on those short-term focused wins, like coordinating care for children or promoting the adoption of advanced directives among their residents, as a springboard to further collaborations. They create an ongoing engagement as a way not only to expand their reach, but to deepen their impact. Most groups in Phase 2 of the pathway are striving to create the conditions for enabling ongoing collaboration. They're learning from experiments and they're building capacity in a region to do more together over time. So let's talk about what elements help enable leadership groups in Phase 2 to be effective. First, it's a diverse team and it stays actively engaged, and they're a group of people who are willing to be stewards and to talk about how to steer the whole health system in a better direction. Secondly, it's a team that's working to create the conditions for a small number of pieces of change work to be done, that are opportunities to learn more about what's needed and what works, and about how to build trusting relationships across organizational boundaries. And finally, it's a team that's really effective at investing in a support structure, getting commitments from its key members to begin jointly investing in the necessary capacity to coordinate their shared work over time. One example of an engage phase effort is in New England. In this region, leaders representing major regional employers, the social services sector, the university, the hospital, and members of the community formed an ongoing stewardship group. They invited an even broader swath of leaders to come together to tackle the health and healthcare challenges and to work together to define a vision for the future of the region. Together, they've established key priorities, including coordinating care, engaging workplaces in healthy behavior, and altering payment systems towards global payment. They've secured investments to fund the staff, and they've launched 3 circles of innovation. In this presentation, we're going to cover 3 different pitfalls of the engage phase, and then we'll address each one in turn by describing the kinds of momentum builders that will help you to avoid these pitfalls. We'll focus on the key stewardship group that leads your effort, paying attention to what it takes to build a great stewardship team to lead the ongoing engagement work of this phase of the pathway. The Stewardship Team Diagnostic Checklist is a good reference to have in front of you as you think about your own stewardship team's design. You can find it on the Engage Phase page of the Stewardship Guide. So, what are the things that you need to consider about your stewardship team? First, a common misstep for many in Phase 2 is the failure to articulate a clear purpose or a set of goals for the stewardship team itself. While it's not unusual for people from different organizations to come together to solve challenging problems, it's a very big leap for a group of leaders to feel that they are authorized, that they have the right to lead on behalf of the whole. And it's hard for them to leave their organizational interests at the door and behave as a stewardship team that comes together to lead the whole system. Another common reason that leadership teams falter is due to short-sightedness or the simple difficulty of imagining what's possible. It is very difficult to envision what a truly sustainable health system looks like and how this team can serve to lead it. As a result of these missteps, many groups fall apart, members feel frustrated and directionless, and they see the effort as futile, and they wind up dropping out. The second common pitfall of Phase 2 is that the wrong people are convening. Making sure that the right people are at the table is a very important step, but it's one that many groups don't think carefully enough about. Very often, collaborative efforts focus on getting all the right interests or all the right stakeholder groups represented at the table. Then when they participate, they represent their respective interests. They'll not necessarily be stewarding the effort on behalf of the whole. Second, the very natural question about who should come from each group or organization is usually answered by what position are they in? Is it a natural part of their day job? Are they senior enough to make decisions? Rather than, do they have a history of working with other leaders collaboratively on tough issues? And so we wind up with team members who are not willing and able to work with their peers effectively. Effective stewardship team members do have to be well positioned. They do have to have authority, but they still have to be able to work effectively with their peers. Third, chief executives are busy people. While many efforts might start with the senior-most leaders around the table, often those leaders drift away after a project is defined, and they may be replaced with more junior people who don't have the legitimacy to commit to more. And often when there is a project focus, a leadership team will leave some very significant potential partners out of the conversation because they weren't needed for that particular project. A leadership team can't steward the whole system with key perspectives missing from the dialogue. Without a diverse enough group of leaders from public health, the providers, the community, the payers, the group as a whole can't see the whole system. And system thinking itself, a conceptual ability that not everybody has, is a critical ingredient in a team of leaders that is going to need to move a whole system in a better direction. Without a committed team of well-positioned leaders who are willing and able to lead for the whole, what happens is that we see people who are holding discussions but not making decisions or taking action, or we see them getting into tough topics much too soon when relationships are not yet trusting enough to have the hard conversations. Or we see them pick a small task to do because at least then they can feel that they are accomplishing something. The third key pitfall is missing structure. How to keep stewardship groups engaged, committed, and moving forward are big challenges that need to be overcome in order to achieve success in phase 2. People don't want to feel that they are wasting their time. Leaders are busy people who feel very responsible for their constituencies and who want to influence real change. They want to make decisions and take action. Too often, the conversations in a stewardship group stay at the surface, avoiding the real challenges. But that being said, it's also very critical to build trust along the way. If the hot-button issues come out in the discourse of a fledgling leadership team, long-brewing conflicts can surface and destroy what trust has been built. And too often, we find that these conflicts completely stall a collaborative effort when they arise, and they can even result in the disbanding of leadership groups. For example, one regional leadership group that convened in the Western United States to redesign care for their residents never addressed the fact that 2 hospitals were expanding competing cancer centers. When the issue of competition and too much capacity came into the conversation, both players walked away because they never agreed that this group could become a forum for talking about some of the harder challenges in the region. So, let me share what we've learned about how to build momentum for stewardship in phase 2 and how you can avoid the kinds of problems we've just outlined. A key momentum builder for phase 2 is to craft a compelling purpose for the stewardship team. One way to get there is for a key champion of the effort to call others to the table and to create the opportunity for them to really connect around shared values, not just as representatives of their organizations. We've seen over and over again how using stories, personal narratives, can help build champions and get others to connect with each other in a way that fosters continued collaboration. It can have a tremendous impact when the change makers share their stories that illustrate why they feel called to lead. These personal narratives are important ways to connect your story, your values, your experiences, and your aspirations to those that you want to work with. And it also helps to build trust, and it provides a sense of shared values that rise above those organizational interests. From those stories and the shared values that they express, it becomes possible to imagine a purpose for a stewardship team that all the members can sign up for. For example, one group that we know realized that all their personal stories, as they told them to each other, were about taking responsibility to make things better for others. When you think about your stewardship team, ask yourself, is its purpose clear? Would we know what it looked like if we were able to accomplish it? Is it challenging? Is it real leadership work that will demand the best of us? And is it consequential? Will it have an important impact on the lives and on the work of others? If so, that's a compelling purpose, a purpose that'll keep leaders engaged, aligned, and motivated to take the next step together. So, for example, the stewardship team in the Upper Valley of Vermont and New Hampshire identified their leadership team purpose to be a group of acting stewards who took responsibility to get something major started and to create a collaborative approach to changing the whole health system for the better. They wanted to create a model that would inspire others, and they took responsibility to create the conditions for many others in the region to join in the effort. To see an example of using narrative to articulate values, see the Story of Self tool, where you'll see Elliot Fisher share his personal narrative. The second key momentum builder to address these pitfalls is getting the right people at the table. I said earlier that one of the roles of a change effort champion is to help the team craft its compelling purpose. Another is to recruit the right people to the stewardship team. A great champion is someone who has neutral standing among the organizations in the system, somebody who has moral authority and is already seen by others as leading on behalf of the whole. That person can recruit others to the stewardship table explicitly to join in a stewardship role, to lead on behalf of the whole, and not just on behalf of his or her own organization. That champion should also keep an eye on the breadth of the team to make sure that they are helping the team gain legitimacy in the eyes of the people it serves. We'll talk more about the way that stewardship teams gain legitimacy when we talk about Phase 4, but for now, let's just note that a group that's going to plant the seeds for system change needs diversity in who they are seen to represent and in what kind of perspectives on the system that they bring. To underscore, well-composed stewardship teams don't happen accidentally. They come together because a champion put careful thought and relationship-building effort into identifying a group of collaborative, systems-thinking leaders who are willing and able to lead on behalf of the whole. We've created a tool to help guide your thinking about composing or recomposing your stewardship team well and communicating to potential members what that role entails. It's called the Job Description for Stewards. A third key momentum builder for a stewardship group in Phase 2 is to create an enabling team structure to support their efforts. There are two pieces of structure in particular that are worth attention right from the very beginning. First, make sure that the work that leaders do when they convene is real leadership work, not just discussions or information exchange. Some of the stewardship groups we've seen succeed have tackled joint leadership work, such as creating opportunities to involve others in the community so that they can contribute to the vision. Picking specific and worthy experiments or pilots to do together. Calling upon each other to invest in shared infrastructure to make that ongoing collaboration possible. These are all well-structured team tasks, real leadership decisions, real leadership work. The second piece of structure is the norms of conduct, and they need to be explicit and enforced. Stewardship teams need to have an explicit discussion about what is and isn't acceptable behavior throughout their process. Stating a small handful of norms, such as candor and transparency about individuals' concerns, while at the same time maintaining confidentiality about what's said in the room, or welcoming different and even conflicting perspectives. These norms keep the dialogue both constructive and meaningful. Norms are among the most important structures that teams can create for themselves. I want to underscore one last critical point about stewardship teams and how to shape them into really great leadership groups for a change effort. Stewardship teams, like any team, are complex systems. You can't make them be effective, but you can put in place a handful of key conditions to increase the chances that they'll evolve and make progress. A compelling purpose, the right people, and some enabling structures. The best time to put those conditions in place is right from the launch of the group. But if those conditions are not in place at the start, try to find a natural breakpoint in the work of the group, such as when you finish a project, or at the end of the year, or when a member departs, to consider relaunching the team. It's like a do-over. You have a chance then to recruit new leaders, to sharpen the purpose for the next phase of work. It's important to get good at noticing natural breakpoints to relaunch a team in a better way, to fortify it with critical new blood, to sharpen the team's purpose, to elevate the scope of what it aspires to do over time. Stewardship teams evolve over the life of every change effort. We know that stewards who start an effort are not the same people as those who lead it through later phases. And as we'll see, the very significant changes that are called for in Phase 4 can require a quite different stewardship team structure or even multiple teams to get accomplished. We've created a tool to help guide your team relaunch processes called Relaunching a Stewardship Team. If you want to move beyond the engage phase of the pathway and would like to learn more about how you can focus your activities to build more momentum for change, the Developmental Assessment can help you understand more about what the strengths and weaknesses are of your regional effort. Rethink Health, working with many leaders like you around the U.S., has identified 11 conditions which together increase the chances over time that real transformative change takes root and leads to greater and greater impact and ultimately to a radically better health system. Each one of these 11 conditions, from diverse multi-sector champions through a local culture of health, is an important part of your change effort at every phase of the pathway. The developmental assessment can help you rate your effort on each of these 11 conditions. If you want to move beyond the engage phase, look at your scores on the 11 conditions. The more that are scoring 2 or better, phase 2 on the pathway, or better, the more momentum you have going for your effort to move into the third or the align phase of the pathway. Pay particular attention to any areas that are scoring a 1. For example, if you indicate that your effort doesn't yet have a real multi-stakeholder stewardship team, that warrants particular attention for you. How can you build a real stewardship team for your effort? Consider completing the developmental assessment with a learning partner or the change leaders who are most critical to your effort. We've covered in this presentation some of the key pitfalls and momentum builders of Phase 2, the engage phase of regional health transformation. In the next presentation, we'll cover the third phase of the pathway, the align phase. We'll explore what's involved in stewarding an effort from the engage phase into and through Phase 3, align. You can find a link to all the tools that we have mentioned in this presentation